it there, and we can also email a copy of this deck afterwards, and it'll be available. Also, good morning. Again, my name is Adam Rosenberg. Thanks for participating in our stakeholder call. Real brief, I wanted to go over, you've seen the agenda, I wanted to go over a couple things over the next 25 minutes. As we finish this fiscal year that we're in right now, it's comfortable to be able to say that our early projections are in fact on target. We set an audacious goal as an organization, as a board of directors, to bring in over $2 million in revenue, actually $2.1 million in revenue this year, which would be the largest revenue year that the center's ever had in its 25-year existence. And we're expected to be on target. Looking at some early numbers yesterday, we expect to well exceed $2.1 million in revenue raised this year. That said, and you can see on the bottom bullet point, although the commitments are there, the cash available from said revenue isn't always there, and that becomes a challenge in working with multiple government agencies and partnerships there. They have many hoops to jump through, and that doesn't necessarily make our work any easier. So I've spent a great deal amount of time over the last several weeks shoring up those gifts for this year, to making sure that those grants come through and that they'll be more systematic next year. Because I think it's just an unnecessary expenditure of time chasing down money from government agencies when we could be spending our time building program and raising new directions there. And it's significant dollars as well that is outstanding to us. But I believe, fairly confidently, that those monies will come in. They just may not even come in until July. But our revenue is as promised, projected. Our expenses are on target as well. That we certainly didn't exceed what we had expected to cost to run this program this year. We I think had expected to be a $2 million program, and we're coming in at a $2 million program. We didn't really have any. Probably the only unexpected expense we had in the last few weeks, as it got warm, one of the main air conditioning units in the building failed, and there's actually 4 units that need to be replaced in our 100-year-old building, which is a lattice work of old air units there. So we found ourselves having to unexpectedly spend $25,000 to repair some air units, and there's at least another 4 units at that same $25,000 cost that may be necessity to repair later on. The building is a concern of all of ours to figure out how what sort of proactive work needs to be done to repair that. So that's something on our mind. Our fiscal year had several highlights. I think most notably, we really formally launched our foster care medical partnership with the MATCH program. It's a program run by Healthcare Access Maryland to support Baltimore City Department of Social Services there, and MATCH stands for Making All the Children Healthy. And its goal, as I've talked several times in this call over the last 18 months, is that every child who enters foster care gets a medical examination within 2 to 3 days of admission there. And since we launched the program full-time in April, we've been able to meet that demand there. And quite often there are days where we've got 5 to 7 children who have been entered foster care coming to the center. It's a really important partnership that we've created, partially due to one of our medical supporters, Lifebridge Sinai Hospital. They continue to see the vision as to what we can do there and recognize it's part of their community commitment to do some good in the neighborhood and for the city of Baltimore. So they've actually contributed a full-time nurse practitioner for BCAC to be able to see this volume of cases there. The medical staff in some ways has never been larger than it is now. And that's really it's a good thing, because I think we recognize that child maltreatment is a medical issue and not just a criminal justice issue. Foster care program will be able to, hopefully towards the end of the calendar year, have a real idea as to how many children are coming in there. But there were a lot of hiccups as it started out. I mean, it's hard to bring a program together with a completely new set of partners that haven't done this before. And a lot of it ends up being contingent on well-meaning foster care workers and foster families to bring these children to get that medical examination. But we do our best every day to eliminate any issues or problems that may be out there. We enjoy the ability to do this. We held our second annual Be a Hero event in the backdrop of the unrest in Baltimore City. We had to make some really quick, difficult decisions in the 11th hour as the city of Baltimore began to become a more difficult place throughout that week. We did not want our event to be a distraction to the police department, to the city. We knew that we had 700 people expected to attend, and we thought bringing those people down there would have been challenging. We had issues of curfew to deal with, and we certainly had even Robin Quivers, who was our keynote speaker, speaking at Howard Stern, wondering how we could have an event in the midst of the city. So we've got good leadership here at BCAC. I'm really proud of both the staff and the chair people of this event who were able to make quick decisions. And we decided to move the event to a venue in Baltimore County that was able and eager to receive us. And miraculously, we still had over 700 attendees at our event, and we raised a staggering $387,000. It was quite a night. The pictures are available on our Facebook page, and as soon as we get the video from the event that we're still waiting to get, we'll post that as well. Robin's speech was, in my words, electrifying. She really spoke not about Baba Booey, but really about the impact of childhood sexual abuse on a child and how it changes one's life. And she could not have put it in any better way. And if that wasn't gift enough, Robin also generously donated 2 auctions of the Stern Show, which for us raised over $50,000 in additional revenue, which is just remarkable. She truly is one of our heroes to have participated in that, as is our stellar our staff, Jenny Trust, as well as our chairs, Jamie Smith, Jen Sachs, and Colby Simon, and they're really remarkable committee. We did a number of legislative briefings this year. We made it a point to really get out there and be in Annapolis. We met with well over a dozen legislators in the city, in Annapolis, and Washington, D.C. over the last year, so people know who Baltimore Child Abuse Center is, what we do. And probably the highlight of that was to do an ACES briefing, similar to the one I did with all of you on the phone for the Senate Education and Health Committee back in January. Hopefully that provided a great deal of background and backdrop information for them in their future dealings. We hope that continues to be a good partnership. We expanded our professional development offerings. We had a lot of classes at the center here, our CAC 101, 201 series, teaching professionals how to do this great work and give them the background that they need necessary. Ruby Nelson has been our lead educator, presenter, and a lot of that work there. And I'm proud of her, but sorry to announce that she's taken a new job in Washington, D.C. In terms of their Director of Community Affairs, and so she'll certainly be greatly missed. But the Ruby and our whole team here did a great job providing professional development. We also provided professional development opportunities throughout the state and even the country for other children's advocacy centers. We definitely set the stage and set the standard how forensic interviewing should be done and how multidisciplinary teams should work. And we were engaged by Frederick County and by Talbot County and by national peer review models to explain to other centers how we do what we do. We truly set the stage here. Whether it's a highlight or not, it's certainly important to share the number that we saw 610 children this year to date. While the month is not done, and that may increase. It was also, interestingly, the lowest number of children we've seen in well over a decade, if not perhaps even the center's history. And I think the numbers sort of speak for themselves. There was a very unexpected dip in the cases being brought to the center over a 4-month period that you can see down here, which I think provided an unexpected challenge there. We can do this. This January period here really was unexpectedly low, and that this is not a normal dip. So we've been exploring why those numbers went down significantly over the last quarter, and I think those numbers have been on an uptick since May started. Certainly, there was a temporary hiccup as the riots and arrest occurred here in the city there, but our team still went out, in the midst of one night of rioting to respond to children who'd witnessed a homicide. So our team was still and continued to be prepared to attend. You can see, interestingly, some of the other numbers that are here. In fact, that we have continue to see cases in additional areas there of physical abuse, of witness to abduction there, witnessing to homicide, and witnessing violence. Those are areas that I think will continue to grow as our services expand and as the Baltimore Police Department understands what we can do for them. And then even from a 3-year trending standpoint, you can unfortunately see the dip that's here, which is something that is certainly alarming, I think, to all of us. That this is just really sort of an unprecedented drop from a high several years ago to what we're seeing today, and the largest dip coming obviously from cases of sexual abuse. So we're working on this. We're working with our police partners. We're working with the mayor's office. We're working with our partners in Child Protective Services. We don't believe we've solved the problem of child abuse. So I think it's a matter of communication and what's happening in the city, and changes in a variety of leaderships. And I think that our role in a lot of this is to keep our eye on the prize, and that it is our responsibility to act as ombudsman for the city, to be able to say, look, numbers are down and something must be amiss, something's not right. It's not because we are that there's just less abuse. Certainly a 2-year period wouldn't account for that, but I think that people may not be reporting it, or cases may be falling through the cracks, and that is alarming and worrisome. Fortunately, I think numbers have gone up over recent weeks, and we'll see how that develops from there. Last highlight from the year that it's worth sharing with this phone call is we did an update of our mission statement. And while it's not a dramatic update, we updated to be able to reflect some of the other services and areas that we recognized that child abuse, sexual child abuse intersects, as well as our own staff's expertise there. And so we really want to be able to provide all victims of adverse childhood experiences, but we wanted to be able to certainly highlight child sexual abuse and trauma, that we can do these things there. And that where it used to say that we really would focus on forensic interviews, we want to make sure that we're providing medical treatment and mental health treatment as well. As we get into fiscal 16, we'll be going in a strategic planning process, which I think will further flesh out those discussions there. We've, in response to the crises that occurred in Baltimore, and I think really as a natural extension to children who have been exposed to violence, children who witnessed violence, the passage of House Bill 306 2 years ago, we made ourselves available for children who witnessed violence, who witnessed rioting there. That the city itself, I think, everyone's been looking for solutions and ways to help these families, and there's been some really remarkable stories shared in the Baltimore Sun over the last several weeks about children who've witnessed rioting and witnessed violence there. And for some children, look, this isn't any different than what they see the rest of the year there. And that's something we've been working on for a long time. So we have been actively promoting the fact that our counselors are in fact available to serve these kids, that they're able to provide counseling and provide risk assessments and resources for families. The biggest challenge is, I think, getting that word out there and even letting families know that their child's been adversely impacted by witnessing violence in their community, and they need to do something about it. And that is a real challenge. And so if there's anything you take away from this phone call, it's, I think, spreading the word that Baltimore Child Abuse Center is open and available and ready to receive children who are having issues after they witness violence in their community there. We are doing this for free, and I'm proud to be able to say that because our staff of social workers want to be able to help these kids, and we're offering this free of charge. To continue to do it, we will, of course, need future funding to do so. That there's a number of grant opportunities that are out there that we apply for, some of which we get, some of which we don't. I think there's a lot of people trying to provide solutions at this moment in time for the city, and this is what we believe is the necessary response that's out there. Unfortunately, it's not always seen as a priority to get kids mental health and treatment, but we know it is. We know that the long-term impacts of kids who've seen this can be traumatic there. if you've got suggestions as to how to spread this word. I mean, we intend to go into the community, but we need your help as well. Starting this summer, we'll be working with Darkness to Light. Darkness to Light ends up unintentionally working with this problem as well. Darkness to Light is a national leader in community solutions to prevent and end child sexual abuse. It is run throughout the nation. It started in Charleston, South Carolina, and they have developed a series of programs that are designed to go out in the community and train the trainer and get the community involved. There's a lot of people who've been trained by Darkness to Light. I mean, they're quite proud of the hundreds of thousands of people who've been trained and the thousands of trainers that they have there. The part that Baltimore Child Abuse Center intends on bringing to the solution here is funded by a grant from the William and Irene Weinberg Family Foundation. And what we intend on doing is not only training people, but also making sure that people who we train are in fact supported, that they have good resources available, that they become the best trainers possible. We felt it would be irresponsible for us to just train people in Darkness to Light and then let them go out on their own, when we have expertise here who can be supportive in that role there, who can help them make them better speakers, better presenters, provide them with the resources in case there's a triggering event during the during the presentation there. And we think that we can make it an even better program. So we want people to be trained in it. We're looking for volunteers, people who want to learn about this and then take us back into the community. Our focus area for at first is going to be on, interestingly, 21215, the Park Heights community, which, as you can see from the map here, we've mapped out the number of children who we've seen where they live. This is not necessarily where the abuse occurred. It is not to say that one zip code is safer or more abuse-related than another zip code. This is simply where kids live who've been reported victims of abuse. And we picked 21215 because, as you can see, it has the highest number of children seen over a 3-year period there, staggeringly much bigger than any other zip code in the city. What's interesting to note, however, is that is North Avenue, and really the epicenter of a lot of Baltimore's unrest and rioting in the days since Freddie Gray. North Avenue runs right between the zip codes with the next two highest numbers of children living there, 21216 and 21217. And I think it's indicative to state that this is part of the problem. These three zip codes, 151617, are the three highest numbers in the city, and that here's Lake Montebello, here's Mondawmin Mall. This zone here is historically a very deeply troubled area of the city that doesn't necessarily always receive, I think, the focus that it deserves. A lot of attention, I think, gets paid around the east side, around EBDI, on the west side, and biotech. But here's a portion that I think needs additional attention, and perhaps it's coincidental, but that if there's historically a lot of children who've grown up witnessing adverse experiences, they it's certainly manifesting itself in future, perhaps, violence and outrage. And we think that's a natural fit for us. 21215, 6, and 7 also happen to be areas that I think a number of community leaders are looking at to provide solutions, and we hope to provide that solution as well. I feel like I'm whipping through a lot of interesting things here, but I guess it's just good to give people a concept as to what's going on. The next thing, which I think works to solve a lot of these solutions, is something that internally, and perhaps we'll continue to call, but a blueprint for child protection. It's a draft concept, but the concept is such that we want to be able to take our message relating to preventing child abuse and minimizing risk, that we've done a very good job in our professional development trainings for youth serving organizations and summer camps and a number of institutions, and see how we can find many partners to help underscore that message and make a great deal of change. Our goal is to really be able to create a community-wide change with some of these things there, and maybe even having organizations who work with children and who fund child organizations to put their money where their mouth is. That if they want to be able to help children have better, healthier outcomes, then how can we work with them to help ensure and underscore some of the most critical aspects of that? And so I believe that if we get a number of institutions who support other youth-serving organizations, foundations, government, hospitals, who are really in the community and are driving the engine and driving the agenda, that if they're working alongside with us to help incorporate a series of standards that organizations should have, perhaps then we'll have real systematic change and numbers will eventually go down. Change model is essentially this, that an institution, whether it's a funding institution, a foundation, adopts their mission. They have a mission to protect children. They have a mission to make sure kids have healthier outcomes there. As a requirement of being a grantee of one of those agencies or to work with one of those agencies, an individual youth-serving organization would need to accept that mandate to make change. And the change I'm talking about is really threefold. One is having policies and procedures in place relating to the protection of and reporting of child abuse. Two is having appropriate background checks. There's a lot of small youth-serving organizations that just simply don't take the effort to do a background check and to make sure that the people who are working there or volunteering there are appropriate to be around children. And unfortunately, we know that the pedophiles, the sex offenders, find the programs that don't do background checks. And so organizations should be doing background checks. So one is policies, two are background checks, and three is some sort of annual training so their staff is aware of these issues and knows what they need to do to be on the lookout, so that if they come across a situation they can report it or they can respond to it appropriately. Those are three very basic things that any youth-serving organization should do. These are standards that are put forth by the Centers for Disease Control. These are standards that are put forth by any training program, any protection program, and many insurance companies want it as well there. As a nonprofit, we're required to file and share our own 990 IRS tax information, but we're never required to demonstrate that we're going to be good stewards of it and protect children with that. So with that threefold notion there, the individual organization accepts that change, and then children end up being protected against maltreatment and negligence because each organization is doing a better job, which then the community itself evolves with this standard there, that every organization that's looking after kids are doing just simply a better job protecting them in their midst. So we get a lot of different circles of influence. If the funding organization makes these standards, then the youth-serving organization becomes a better organization as a result, and then the adults who work there recognize they have to follow that standard, and ultimately the children at the youth-serving organization, whether it's daycare center, summer camp, karate program, whatever it is, are all protected. And I think by getting more of these institutions, organizations like the United Way, for example, to adopt some of these strategies, we can exert our influence on a much greater scope. It would take a lot of time for us to be able to reach 3,000 children, but we can impact that change in a much more effective and efficient manner by partnering with someone like the United Way or like a philanthropic foundation or a government agency who wishes to adopt some of these standards before they allow programs to start working there. And so if United Way, for example, funds 30 youth-serving organizations, 30 youth-serving organizations have 30 adults work at each organization. That's 900 adults who've now been trained in doing better work and being mindful of protecting children. And if each of these programs have 100 kids, that's 3,000 if my math is correct. And I don't think it's that audacious or ambitious to do. I think it's something that can have a great impact and have a lot of different partners in prevention there. So honestly, as we hit the nth hour here before I open up for questions, thank you. Thank you all of you who participate in this, who watch these phone calls, who call with your questions and your concerns, who make gifts. Thank you for a successful year. You give us the ability to work with you to protect children and really build a better future for these children there. It is not enough to just respond when there's been an outcry of abuse, but to be able to do something about it to help these kids and protect them in the future. But also, thanking you for your time. You give your time and your talent and your treasure. Each of you who participate in these calls, care about this issue here, and that goes a long way. We would not be able to do this without all of you involved. So thank you for your participation. And it's 11 o'clock, but let me open up for any questions and answers. Provide some answers if you have questions. You can unmute your device. You can ask a question. If you want to chat, you can chat. I guess on the chat board. Otherwise, we appreciate your time. And feel free to send an email to either myself or Jenny Trust. Well, I should add that to this. I can do that easily, I bet. How do I end the presentation? Don't want to keep your ink. No, discard. Yeah, so if you have any questions, you can certainly email them to jtrust@bcaci.org, or you can give us a call at, there you go, at 410-396-6147, and we'd be happy to continue the conversation here. Where a great forum for us is Facebook, facebook.com/BCAC. Is our address there, and obviously our website is bcaci.org. Stay tuned. We hope to launch our new website sometime towards the end of the summer. Any other questions? Well, thank you again. We appreciate your time, and we look forward to continuing the conversation in the fall.